Well, that old saying, hard work never killed anybody, well, that may not be true. A new study found the more people work, the higher their stroke risk.
Yeah, Dr. Ronald Tarrel from Norin Neurological Clinic and Abbott Northwestern is here to talk about what this new study means and ways to minimize the risk of stroke. Good morning. Good to see you.
Good to see you guys. Glad to be here.
All right, so let's talk about the study itself. What's the link between overworking and basically stroke risk?
There is a link, and what they actually did was they took information from many previous studies that happened to incorporate people's work hours and their risk of stroke and also coronary artery disease. And when they pooled all this information together, they found that there was a link between increased work, something greater than 40 hours, and your risk of stroke. And it panned out as an independent risk factor, independent of all the other risk factors that could lead to stroke.
So what is it about putting in the extra hours? What specifically, how does it affect your body and your chances of stroke increasing?
Everything is about healthy living. And the idea, I think, behind it is that if you're working extra hours, you may be sleeping less, you may have increased anxiety, increased stress, your eating may be not as good as it should be, not as regular as it should be. And when you have all that working against your health in general, there's going to be an increased risk. It's one factor that probably brings out the risk of the more established risk factors of stroke, like diabetes, hypertension, heart disease, cholesterol, all of those things.
As someone yourself that's probably worked a lot of overtime with whatever your training you did to become a doctor, because there are years of it, and I'm assuming it was, 60, 80, 100-hour work weeks.
They can be.
What does this mean for someone like you who has been overworked? Does this really hit home, or is it like, maybe it's just a little something extra to pay attention to?
I can tell you personally it hits home because I'm still not famous for getting enough sleep. But there were changes into how residents and interns were scheduled and how they went through their rotations through the hospital. It must have been about 15 years ago or so, maybe a little more, where they actually limited the number of hours they worked because they were recording mistakes being made based on these residents and interns being overtired. So they cut back on the work hours, and it was put in as a federal law.
Okay, well, and that makes sense. Let's talk now about symptoms. If you are at risk for a stroke, what are some of the things that people need to be aware of as far as, on their body, what's going on in their body?
Right. Now, the warning signs of stroke are always a sudden change in neurologic function, a sudden loss of neurologic function. So if you have a sudden onset of weakness or numbness on one side of the body, sudden difficulty speaking or maybe understanding what others are saying to you, sudden difficulty with eye movements, eyesight, anything that happens suddenly and ends up in a loss of function, you call 911 right away, because that could be a stroke. And our treatments, which are advancing literally daily into what we can do, are all based on time. And if the earlier we get to someone, the earlier we evaluate them, the better we can treat them.
So obviously, those are basically key things to look for having a stroke. How do you minimize the risk of even getting one?
You do that by minimizing the risk factors. So in this case, brought out by this study, try not to work so much. And if you do, I think it's important that you really emphasize your free time, not just your sleep, which is also important and an independent risk factor of stroke, but also just having relaxation time. Eat well, take care of any underlying physical risk factors you may have, such as the diabetes, hypertension, heart disease, and just keep a good balance.
Yeah, that's something I think most of us struggle with at some point or another in our lives is the balance factor. But you have to find a place, even if you have a high stress day at your job, to power down and maybe bring down. Your heart racing or those things that tend to happen when you're stressed out.
Do you have any suggestions on someone that, say, has to work 70 or 80 hours a week? Because there are some people that have to do that, have no choice. Do you have any suggestions on how they can form the rest of their life to kind of power down those crucial moments?
Meditation or...
Those are all great ideas. First of all, I don't want them to panic. When they say there's an increased risk, when it really comes down to the numbers about your risk of stroke, the increased risk of stroke from the increased work hours is very minimal. It's measurable, but it's minimal.
Okay.
That being said, that person has to take that extra time and really take care of themselves. Because sometimes you know how it goes with work. Work doesn't stop.
No.
Our minds are continuously going. Meditation, exercise, eating well, those are huge factors.
Okay.
All right. Well, Dr. Ronald Tarrel from NORAN Neurological Clinic at the Abbott Northwestern Hospital. Thank you so much for joining us this
Glad to
morning.
be here. Thank you.
Appreciate it.
All right. Good things to think about, and hopefully you can find that balance.